Hello and welcome to Non-Interpretive Skills in Radiology. My name is Nadia Kedem and today we will talk about ethics in radiology. Now before you hit the mental snooze button, I promise you this is going to be more interesting than you think, because we're not just going to talk about dry abstract concepts. We're talking about what makes us as radiologists trusted professionals. And if you think about it, that's a pretty big deal. So let's start with the basics. Merriam-Webster defines a profession as, and I quote, a calling requiring specialized knowledge and often long and intensive academic preparation. Duh, sounds familiar, yeah? That's us, radiologists. Years of training, ridiculous board exam, and countless sleepless nights reviewing images. We didn't just stumble into this profession, we earned it. But here's the kicker. Being a professional doesn't just mean you know a lot about MRIs or CT scans. It means that society, our patients, have placed their trust in us. And in return, we have a contract with them. Not a written one, but a moral and ethical one. And that's where professionalism comes in. Merriam-Webster defines professionalism as the conduct, aims, or qualities that characterize or mark a profession or professional person. In simpler terms, professionalism is about how we show up. It's about how we treat our patients, how we make decisions, and how we keep our moral compass pointed in the right direction. And guess what? There's actually a pretty handy roadmap for all of this called the Physician Charter. It was put together by the American Board of Internal Medicine, and it lays out 10 professional responsibilities. But don't worry, we're not covering all these 10 today. We're just going to focus the 3 major ethical principles, and I promise you these principles are baked into everything we do as radiologists. The first principle is the principle of primacy of patient welfare. So what does that mean? It means the patient comes first, always. It sounds obvious, right? But I tell you, it's not always easy. So picture this, you're reading a scan and you spot something subtle, maybe a tiny lung nodule or questionable lesion in the brain. You could just say, I recommend follow-up in 12 months, sign your report and move on. Or you could pick up the phone, call the referring physician, and advocate for the patient by making sure the referring provider knows about this finding and will take this follow-up action, even if this means more work for you. Because at the end of the day, patients' welfare, not hospital metrics, not insurance coverage, not time constraints, has to be our priority. And here's the hard part. Sometimes market forces, administrative pressures, or even societal trends start to cloud that judgment. Maybe the hospital wants shorter turnaround times. Maybe insurance companies deny coverage for follow-ups. Maybe the volume of cases is crushing you. But our goal is clear. None of that can compromise the patient's best interest. If we do our job right, the patient wins every time. Now let's shift gears to principle number 2, patient autonomy. This one's a game changer. It basically says patients have the right to make their own healthcare decisions, and it's our job to help them make informed decisions, not to make decisions for them. Now you might be thinking, but I'm a radiologist, I don't interact with patients that much, and that's true. But there are some examples connecting our work directly with patient autonomy. For example, our radiology reports contribute to the decisions that our patients make about their care. So clear, honest, unambiguous language empowers the patient and their clinical team to make informed choices. So the next time you're crafting a report, think about who is reading it and how is it going to influence patient autonomy. Your words have more power than you think. But autonomy goes deeper than that. Sometimes patients will make choices that we don't agree with, like declining IV contrast. The technologists sometimes call to announce, oh, the patient refuses the IV contrast. What should we do? But a better way to break this news would be to say the patient prefers not to get the IV contrast. As long as the patient has all the information, all the pros and cons of that decision, we need to respect it. That's their right. As long as their decision is based on solid information and aligns with ethical care, we have to respect it, even if it makes us uncomfortable. All right, last big one. Principle number 3, social justice. Now I know social justice might sound like a term reserved for protests and political debates, but in medicine and in radiology, it's very real. It means that healthcare should be fair. Every patient, regardless of their race, socioeconomic status, gender, or any other background, deserves the same level of care, period. But here's where it gets tricky. We know that health disparities are real. We know that certain patient populations get fewer scans, less follow-up, sometimes worse outcomes. And here's where we, as radiologists, as physicians, can make a difference. For example, we can bring imaging equipment to underserved areas to facilitate access for the patients who live there. Or let's say you notice that a particular group is being consistently under-imaged or denied care. You have the power to speak up and change that. Social justice isn't just a nice sounding concept, it's literally part of our professional contract with society. We must promote fairness in healthcare, and that's not a suggestion, it's an obligation. So let's wrap this all up. There are 3 core ethic principles that are basically the modern adaptation of the Hippocratic Oath. Number 1, always prioritize patient welfare, no exceptions. Number 2, respect patient autonomy, empower them to make their own informed choices. And number 3, promote social justice, fight for fair, unbiased healthcare. A professional, a radiologist, understands that their work has profound human implications, because behind every scan is a human being, someone's mother, father, child, or friend, whose life could change based on what you find and how you communicate it. So I'll leave you with this. Next time you open a scan, ask yourself, am I putting the patient's best interest first? Am I communicating clearly enough to empower informed decisions? Am I promoting fair and equal healthcare regardless of the patient's background? Because that, ladies and gentlemen, is what it really means to be a professional in radiology. Thank you so much for listening to this, and next time we talk about those 10 principles of ethics in radiology. Thank you. Bye.